That's not Dr. Coimbra. Oh, sure, say hi.
Congratulations. Congratulations. She doesn't usually come up when Jim's not around. Am I Asian? She said, oh, you're Asian. Okay, let's do
So awesome.
this is the all surprise!
What is this?
Nothing.
You guys kidding me?
You
You were outside of the hospital. Oh,
all here for you.
thank you very much. We're there. You guys. Wow, look at this. I should not be on call tonight.
It's landed that way.
Thank you.
It's a reprieve. You're off the hook.
Well, we had to get a recess right now. So what are we doing?
Okay. Congratulations, Dr. Coimbra. We recently found out about the many accomplishments you've achieved in the last year. We, the staff that work under your direction, would like to show our appreciation and congratulate you. We are proud to be part of the trauma team here at UCSD under your direction. We look forward to the education and direction that these experiences will bring to our UCSD Trauma Center to enhance our patient care. The following are some of your accomplishments.
Not true.
Not true.
Don't believe on everything they say.
The good ones first. The Monroe E. Trout Endowed Chair. This endowed chair acknowledges a true surgeon scientist whose pioneering efforts have made enormous life-saving impact on both the United States and South America. The $2 million endowed faculty chair will enable Dr. Coimbra to recruit the nation's best talent and to support the expanding trauma research and prevention programs at UCSD Medical Center.
Wow.
See me later.
Executive Vice Chair of the American College of Surgeons Committee on Trauma, for short ASCOT. ASCOT is the most prominent trauma association in the United States. The mission of ASCOT is to develop and implement meaningful programs for trauma care in local, regional, national, and international arenas. These programs must include education, professional development, standards of care, and assessment of outcomes. One of these programs we use here at UCSD is ATLS. And now it's Mary.
Dr. Coimbra is also president of the Pan American Trauma Society. The Pan American Trauma Society seeks to encourage the exchange of knowledge and information between and among physicians, nurses, pre-hospital providers, and other healthcare personnel who take care of injured patients in North, Central, and South America. That's a big job.
Wow.
He is also chair of the Southeast Regional Trauma Coordinating Committee. This committee includes representatives from trauma centers, county emergency medical services, pre-hospital providers for the counties of San Diego, Imperial, Riverside, and San Bernardino, our backyard. And Bruno, your dad, does this too. He was recently appointed to sit on the California Trauma Advisory Committee for the State Emergency Medical Services Authority. The mission of this is to ensure quality patient care by administering an effective statewide system of coordinated emergency medical care, injury prevention, and disaster medical responses.
Wow.
Impressive.
You made it on the January 2010 magazine, San Diego Magazine, 50 People to Watch. And there is a section here about Dr. Coimbra's accomplishments. However, it's just a small paragraph. It doesn't do any justice to it. And just to let you know that how they picked the 50 people to watch in 2010 is it's among the San Diego Magazine readers' favorites. And also, you were a finalist. Even the business world has recognized your efforts. San Diego Business Journal has named you a healthcare champion in 2009. Here is your plaque, which you probably already have this in your office. Devoted trauma surgeons such as Coimbra continue to work tirelessly to return the trauma victim to as normal a life as possible with the best possible quality of life as soon as possible. Dr. Coimbra's work extends past the emergency room. I think they meant trauma room. He founded UC San Diego Center for Trauma Research, Prevention, and Education in March of 2009. And also, you took first place in the American College of Surgeons Committee on Trauma Basic Science paper competition in December of 2008. I don't think you know this, but one of the reasons why I came to UCSD was hearing you speak about the unit. Back when I was in MICN years ago, you would give lectures at the field care audits, and one thing that really stood out was how highly you spoke of not just your colleagues, but your team, but also the unit. When you were the director of the SICU, you really spoke highly of the nurses and all of the staff, and it really, really stood out in my mind. So when it came time for me to look for a place to work, it was a no-brainer, and that's one of the reasons why I came here. And I hear you, you talk us up very highly, and you have a lot of confidence in us, and we're very grateful, and we really appreciate your efforts, and we don't get an opportunity to let you know how we feel, and we're very thankful and proud to be a part of your team, and we thank Dr. Sandra Coimbra also for her supporting you in making all of this possible as well. So.
And before that both Lisa and I want to say, first of all, we want to thank every one of you for coming and being here to recognize Dr. Coimbra. Specifically, I just want to thank Juana and Madeline and our SICU management team for their support, and all of the SICU nurses who helped make this happen, for bringing food in and for supporting us. Of course, we want to thank Megan Spence, and I know she's been kind of hiding and doing things. And also, we want to thank Sharon for making, for helping us organize this and contributing for the food.
It scored 90 points on my personal.
You scored it. It must be
It
good.
has a nice label, and this is
So you got to open it though.
I'm honored. I'm Brazilian with Italian blood, so I cry all the time when I get emotional. But you know, I obviously don't deserve this. This is a long journey that reflects the work of a group of people. This is not about me. This is about you and those guys. You know, people that we work with every day, that we learn how to trust each other, and we start building things slowly but surely, and one day, you know, you realize it's getting bigger and bigger. And but obviously I would never be able to do this alone. So none of these accomplishments reflect my talents individually, but it's the group that makes a tremendous effort to provide patient care every day, and this is exactly what makes us proud. I love you guys. Every opportunity I have to speak about the trauma center and the way we run trauma here at UCSD, I always point out, and this is probably what you were referring to when I bring people to visit or to interview fellows or faculty, and I take them to the resus room and I tell them, we work here as a family. We know each other. I look at some of those nurses in the eye, and they know exactly what I'm thinking, and I know exactly what they are thinking. That's what I say. And I say that door, and I point out to the door that connects the trauma room to the ICU. I said that door is what makes us very different from everybody else, because the dedication of those nurses that work in the ICU, that are our trauma nurses, provides continuity of care on the nursing side, and that is exactly what changes patients' outcome. Again, this is a team effort, and nothing would be built if it were not for all of us. So, you know, there is enough food for everybody here, so we should all celebrate.